Hi guys, today we'll talk about psychopathy tests, what they are, and how they're used. If you've ever watched a true crime documentary or read a book about criminal behavior, you've probably heard the term psychopath. But what exactly does it mean to be a psychopath? And how do you identify these traits? Welcome to Wellness Lenses, where we talk about mental health and the journey to self-development. We post videos every Monday and Thursday, with occasional bonus videos on Sundays. Without further ado, let's dive in. First off, it's important to keep in mind that the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, which is the main diagnostic tool used today in the United States, does not recognize the term psychopathy as a formal term. Instead, the antisocial personality disorder, or the ASPD, which is defined by a pervasive disdain for and violation of others' rights, is a comparable diagnostic term. So keep in mind that even though ASPD and psychopathy have some similarities, they are not exactly the same. In order to promote clarity and prevent confusion, it is crucial to utilize accurate diagnostic terminology while discussing mental health issues. Furthermore, employing the proper terminology can help guarantee that people get the right care and support for their unique mental health needs. With that in mind, what are the psychopathy tests? Essentially, it's a psychological evaluation that factors in qualities frequently linked to psychopathy. As you may remember from our earlier videos, psychopathy is a mental illness that's characterized by a lack of empathy, remorse, and conscience, as well as manipulative and impulsive behaviors. In order to help identify people who may pose a risk to themselves or to others, psychopathy exams are frequently utilized in forensic and clinical settings. One of the most widely used psychopathy tests is a Psychopathy Checklist Revised, or PCL-R, which was developed by Canadian psychologist Robert Hare. The PCL-R includes 20 items or questions, which are organized into two broad factors, Factor 1 and Factor 2. Here are some examples of questions on the PCL-R. Factor 1 covers the following items: glibness, superficial charm, or does the person speak in a smooth, charming style that is superficial or insincere? Grandiose feeling of self-worth. Does a person possess an exaggerated sense of entitlement or self-importance? Pathological lying. Does the person have a pattern of telling lies or deceiving people for their own gain? Lack of regret or guilt. Does the person appear nonchalant or uncaring about the hurt they have inflicted on others? Shallow affect. Does the person display a limited range or depth of feelings? Or do they come off as emotionless in circumstances where others might show powerful emotions? On the other hand, Factor 2 covers the following questions. Impulsivity. Does the person behave without thinking through the repercussions or base decisions on the need for instant gratification? Irresponsibility. Does a person disregard their responsibilities to their family, friends, or their job? Juvenile delinquency. Did the person have a history of delinquent behavior when they were younger? Lack of achievable long-term goals. Does the person lack direction or have unrealistic future plans? Revocation of conditional release. Has the person broken the rules of their probation, parole, or other court-ordered supervision? Each item is scored on a 3-point scale, with 0 meaning the item does not apply, 1 meaning the item partially applies, and 2 meaning the item fully applies. The scores for each item are then added up to create 2 overall scores, one for Factor 1, which includes interpersonal and affective traits such as manipulativeness and lack of empathy, and one for Factor 2, which includes lifestyle and antisocial traits such as impulsivity and criminal behavior. The maximum possible score for each factor is 40 points, with a total possible score of 80 points for both factors combined. Scores above 30 are generally considered indicative of psychopathy. The evaluator may additionally give a narrative summary of the person's responses and behaviors that support the scores, in addition to numerical results. Take, for instance, an example of John A., a violent offender with a history of assault and robbery, among other convictions. He is being evaluated by a forensic psychologist utilizing the PCL-R test, while incarcerated in a maximum security facility. John's criminal past, social background, and other pertinent data are reviewed by the psychologist during the assessment. The PCL-R test is also administered by the psychologist. In John's case, his PCL-R score is 35, which falls within the range of high psychopathy. This means that he exhibits many of the hallmark traits of psychopathy, such as callousness, manipulativeness, and a lack of remorse or guilt. John's behavior, according to the psychologist, fits within a pattern of antisocial behavior that started in childhood and has persisted into adulthood. The psychologist informs the court and other relevant parties, including John's defense lawyer and the prison staff, of the results of the evaluation. This assessment may be used to help decide how to handle and manage John while he is incarcerated, as well as how much of a risk he may pose to society if he were to be released. It's crucial to remember that this is only a hypothetical situation, and that there are many different ways to apply the PCL-R in real-life circumstances. When deciding on a person's management or therapy, the results of a psychopathy assessment should never be considered in isolation. Before we move on, guys, if you're on a journey to improve your mental health and well-being, hit that subscribe button and join our community of like-minded individuals. We share videos about different mental health topics and conditions, as well as strategies for developing healthy habits and coping with stress. The Personality Assessment Inventory, or PAI, a self-report questionnaire that assesses a variety of personality traits, including psychopathy, is another frequently used test. Psychologists utilize this method to better understand people's thoughts, feelings, and behaviors. It features several built-in checks to evaluate if the test taker is being truthful and providing the most accurate answers possible. The infrequency scale is one of these checks, and it can be used to determine whether someone is purposefully providing incorrect or exaggerated replies. The negative impression, or the NIM scale, is another tool to look for indications that someone is trying to appear better than they actually are. This 344-question test gives two kinds of scores, raw scores and T-scores. Raw scores show how many points the person earned for each question. T-scores show how the person scores compared to a group of people who took the test before. A T-score of 50 is considered average, while scores above 60 or below 40 are generally considered clinically significant. The evaluator may also offer a narrative interpretation of the findings in addition to the numerical scores, which takes into account the subject's ratings on various scales and subscales, as well as how those ratings relate to one another. The PAI is generally used to assist psychologists in better understanding a person's personality, emotions, and mental health. But it also includes safeguards to ensure the accuracy and validity of the results. Imagine Sarah H., a person who is accused of embezzling money and currently awaits trial. She has been referred to a forensic psychologist for a psychological assessment that will entail the administration of the Personality Assessment Inventory as part of the legal process. First, Sarah is interviewed by the forensic psychologist to learn more about her past, personal history, and current circumstances. The PAI test is then administered. The psychologist evaluates Sarah's responses after she completes the questionnaire, paying close attention to the validity scales that determine whether Sarah was truthful and accurate in her responses. The psychologist adds that Sarah's ratings on numerous clinical scales, including depression, anxiety, and somatic complaints, are high in light of the findings, indicating that she might be going through emotional discomfort. Sarah's low antisocial behavior score, which indicates that she may not be a persistent rule breaker or have a history of criminal behavior, is another observation made by the psychologist. The psychologist gives the court and other pertinent parties which may include Sarah's defense lawyer and the prosecution, an in-depth account of the evaluation. The outcomes of the PAI may be used to guide choices regarding Sarah's legal case, including whether she is competent to stand trial and whether mental health treatment should be included in her sentencing. It's crucial to remember that this is only a hypothetical situation, and that using the PAI in actual situations involves many other factors. The findings of a psychological assessment should always be taken into account alongside other pertinent data, professional judgments, and ethical considerations. The choice of which test to administer, either the Psychopathy Checklist Revised or the PCL-R, or the Personality Assessment Inventory, the PAI, depends on the specific purpose of the assessment and the clinical judgment of the evaluator. In forensic settings, such as prisons or courtrooms, where the assessment of psychopathy may be important to legal procedures, the PCL-R is often administered by forensic psychologists, psychiatrists, or other mental health specialists. The PAI, on the other hand, is a more all-encompassing diagnostic tool that evaluates a variety of personality and emotional traits, including substance use, depression, anxiety, and interpersonal functioning. The PAI is frequently used to evaluate a patient's general psychological functioning and to assist in the diagnosis of mental health issues in professional settings, such as hospitals or private offices. Therefore, the choice of which test to administer depends on the specific goals of the assessment and the context in which it is being conducted. So, why do we need psychopathy tests? Psychopathy is associated with a range of negative outcomes, including criminal behavior, violence, and recidivism. By identifying individuals with psychopathic traits, we can intervene and provide appropriate treatment and support to reduce the risk of harm to themselves or others. Psychopathy tests do have significant limitations, despite having been shown that they can be an effective tool for risk assessment and spotting people who exhibit psychopathic traits. These tests have a potential to give false positives or false negatives, because they are not error-free. And what exactly do we mean by that? Here are some examples of how psychological tests, like the PCL-R and the PAI, could yield false positive results. The first issue is malingering. In order to gain an advantage, such as receiving disability payments or avoiding legal repercussions, some people may fabricate or exaggerate symptoms. Then there is what's called a response bias. People may have a tendency to respond in a particular way, for example, by attempting to show oneself in a way that is socially acceptable, which can provide false findings on personality tests like the PAI. Misdiagnosis is another potential issue. Many mental health conditions, including bipolar disorder and post-traumatic stress disorder, might share symptoms with psychopathy and other personality disorders. Of course, there are cultural distinctions as well. Some people from different backgrounds or ethnic origins might have values, attitudes, and actions that are different from the conventional norms employed in psychological testing. Additionally, false positive results may occur from clinical interview bias or the clinician's own prejudices and preconceptions that were unintentionally included into the assessment. On the other side, the following are a few instances of false negative results from psychological tests. The biggest concern is underreporting. Some people may downplay or deny their symptoms or actions, especially those that are stigmatized or could have adverse consequences, such as drug abuse or criminal behavior. On exams that rely on self-report, like the PAI, this may result in false negative results. And despite the relative thoroughness of psychopathy tests, it's also important to remember that every testing has limitations. For example, some people might not exhibit all of their symptoms or behaviors during a brief evaluation, especially if they are anxious or uncomfortable. This can produce false negative findings, not to mention inaccurate interpretation. False negative test findings could occur from the clinician's own biases, presumptions, or preconceptions, unintentionally influencing how the test results are interpreted. As you can see, overall, researchers and clinicians frequently disagree over the validity and reliability of these assessments, especially those that mainly rely on self-report measures. Additionally, certain critics believe that psychopathy exams could stigmatize those who exhibit psychopathic qualities and result in discrimination or abuse. So, this has been a quick overview of psychopathy tests, their purpose, application, and drawbacks. Psychopathy tests can be a useful tool for determining risk and locating people who exhibit psychopathic traits. Although these tests have several limits and may yield false positive or false negative results, they can nonetheless offer insightful information about a person's personality and behavior. It's critical that clinicians perform and interpret psychological testing very carefully, taking into account the individual's unique background and circumstances. If you found this information helpful or interesting, we encourage you to like and share this video with others who may also find it useful. We also welcome your comments and feedback, so feel free to start a conversation below. And if you'd like to see more content like this, please subscribe to our channel for regular updates on psychology and mental health topics. Thanks for watching, and see you soon.